Prostate cancer is a sneaky and treacherous disease, often overlooked. The major danger is that most men only become aware of its existence when it is already in an advanced stage, drastically reducing the chances of effective treatment. Did you know that in its early stages, this type of cancer hardly presents any obvious symptoms? It is precisely for this reason that so many people only receive a diagnosis when the disease has already reached a critical level, complicating treatment options and reducing the chances of recovery. Before we dive into this fascinating topic, tell us in the comments which city you are watching this video from. Oh, and don't forget to leave your like and subscribe to the channel to receive valuable health information that can make a real difference in your life and the lives of those around you. Now, let's get straight to the point. Today, we are going to reveal the first signs and symptoms of prostate cancer that should never be ignored. Paying attention to these indicators can be the difference between an early diagnosis and a reversible situation. So, stay with us until the end of this video, as this information could literally save your life or the life of someone you love. Prostate cancer is among the most common types of cancer affecting men, especially from the age of 50 onwards. According to data from the World Health Organization, approximately 1 in 6 men will be diagnosed with this cancer in their lifetime. But do you know exactly what the prostate is and what its function is? The prostate is a small gland, shaped like a walnut, located just below the bladder and in front of the rectum. Its main function is to produce seminal fluid, a substance essential for the transport and nourishment of sperm. However, the problem arises when the cells of this gland begin to multiply uncontrollably, leading to the formation of a tumor. In the early stages, this abnormal growth usually occurs slowly and without presenting noticeable symptoms. However, as the tumor expands, it can press on the urethra, the canal through which urine passes, and even affect nearby organs. It is at this point that the first warning signs begin to appear. The major problem is that, in most cases, men only realize something is wrong when the cancer has already reached a more advanced stage, making treatment more complex. But don't worry, because now we're going to show you the symptoms that need to be closely monitored to identify this disease before it's too late. Prostate cancer doesn't arise randomly. There are specific factors that increase the risk of its development. Knowing these factors can help both in prevention and early detection. Here are the main ones. 1. Advanced age. From the age of 50 onwards, the risk of developing prostate cancer increases considerably, becoming even higher after 65. For this reason, regular checkups during this stage of life are essential for early diagnosis. Family history. If a close relative, such as a father, brother, or grandfather, has had prostate cancer, the chances of developing the disease double or even triple, especially if the diagnosis occurred before the age of 55. This shows how much genetics play a crucial role in this type of cancer. Ethnic background. African American men have a higher risk of developing prostate cancer, and in many cases, the disease can manifest more aggressively. Although this is a less discussed factor, it is extremely relevant for assessing individual risk. 4. Poor diet. A diet high in red meat, ultra-processed foods, and saturated fats is directly associated with a higher risk of prostate cancer. On the other hand, consuming fruits, vegetables, and antioxidants, such as lycopene found in tomatoes, can help protect prostate health and reduce the likelihood of developing the disease. 5. Obesity. Excess weight not only increases the risk of more aggressive prostate cancer, but can also make early detection more difficult. Additionally, obesity can compromise the effectiveness of some treatments, making the fight against the disease more complicated. 6. Exposure to chemicals. Professionals who frequently handle pesticides and industrial chemicals are more likely to develop prostate cancer. Prolonged exposure to these compounds can cause cellular changes and increase the risk of malignant mutations. 7. Hormonal imbalance. High levels of testosterone over long periods can stimulate the uncontrolled growth of prostate cells, including cancerous ones. This factor is taken into account in treatments involving hormonal control to reduce disease progression. 8. Lack of physical activity. A sedentary lifestyle is directly linked to obesity, chronic inflammation, and reduced immunity, conditions that can favor the development of prostate cancer. Maintaining a regular exercise routine not only contributes to overall health but also helps protect the prostate by reducing inflammation and strengthening the body. 9. Tobacco and alcohol consumption. Cigarettes contain numerous toxic substances capable of causing cellular mutations, increasing the risk of various types of cancer, including prostate cancer. Excessive alcohol consumption, on the other hand, can trigger chronic inflammation in the body, one of the factors associated with the development of malignant tumors. But how can you reduce these risks? While it's not possible to control factors like age and genetic predisposition, there are several preventive measures that can significantly lower the chances of developing the disease. Maintaining a healthy weight, following a balanced diet, exercising regularly, avoiding smoking, and limiting alcohol consumption are essential habits. But above all, scheduling regular medical checkups is crucial, especially for men over 50 or those with a family history of the disease. Now, we've reached one of the most important moments in this video. We're going to show you the main signs and symptoms of prostate cancer that should be recognized as early as possible. The sooner they are identified, the greater the chances of successful treatment. 1. Difficulty urinating. Imagine trying to turn on a faucet, but instead of a steady stream of water, only a few drops come out intermittently. This is the sensation many men report when noticing this symptom. The explanation is simple. As the tumor grows, it can press on the urethra, the canal responsible for carrying urine out of the body. This can result in a weak, intermittent urine flow, or even the need to strain to urinate. If you notice that you're having trouble emptying your bladder completely, that your urine stream is weak or irregular, don't ignore this symptom. It could be an early sign that something is wrong with your prostate. Increased need to urinate, especially at night. Have you been getting up multiple times to go to the bathroom? While many people associate this solely with aging, it could be a sign of changes in the prostate. This phenomenon is known as nocturia and occurs when the enlarged prostate gland compresses the bladder, reducing its storage capacity and increasing the urge to urinate. If this happens every night, it's a sign that something may be wrong and warrants a medical evaluation. 3. Feeling that the bladder never empties completely. This is a very common symptom but is often ignored. Have you ever urinated and immediately felt like there's still something stuck in your bladder? This sensation could indicate an obstruction in the urinary flow, which may be associated with abnormal prostate growth, whether due to a tumor or benign prostatic hyperplasia. If this difficulty persists, it's essential to see a specialist for a detailed evaluation. Presence of blood in the urine or semen. Although this is one of the most alarming symptoms, many people end up not giving it the attention it deserves. The presence of blood can indicate serious prostate issues, and while it's not always a sign of cancer, it should never be ignored. This symptom usually appears in more advanced stages of the disease, making it even more urgent to seek a medical diagnosis. Any trace of blood in the urine or semen should be investigated immediately. Burning or pain during urination. Many people associate this sensation with a urinary tract infection, and indeed, infections can cause this discomfort. However, if the problem is recurrent or persists even after treatment, it could be a sign that the prostate is inflamed or that there is abnormal growth pressing on the urethra. Paying attention to the frequency and duration of this symptom can help identify a problem before it progresses. Persistent pain in the lower back, hips, or thighs. Few people know this, but when prostate cancer spreads, the bones are often one of the first areas affected. If you've been experiencing deep, continuous pain in these areas that doesn't improve over time and isn't related to physical exertion, be alert. Unlike common muscle pain, this pain usually doesn't have a specific location and can become increasingly intense. Don't underestimate this symptom, as it could indicate that the disease is already in a more advanced stage. Unexplained weight loss accompanied by extreme fatigue. Losing weight without dieting or exercising might seem positive at first glance, but when it happens without an apparent reason, it can be a warning sign. This occurs because, while fighting cancer, the body starts consuming more energy than usual, leading to rapid and unexpected weight loss. Additionally, persistent fatigue is another concerning indicator. Even after a good night's sleep, the feeling of exhaustion doesn't go away. This may be related to chemicals released by the tumor itself, which affect metabolism and drain the body's energy. If you've been feeling constantly exhausted without an obvious explanation, it's essential to investigate the cause. These are the 7 most common signs of prostate cancer. Although some may seem harmless, like waking up at night to urinate, When they occur repeatedly or in combination with other symptoms, it's crucial to see a doctor. The goal here is not to cause fear, but to encourage prevention. Before we continue with this video, I need to ask you, are you feeling tired, struggling to build muscle, or dealing with a decrease in libido? If so, it's time to take action. We present to you the Kai Male Power Guide, featuring 50 natural juice and shake recipes to boost testosterone. This book, filled with delicious and easy-to-make recipes, is the ultimate solution for naturally increasing your testosterone levels so you can feel more energetic, stronger, and confident every day. Get it now by clicking the link in the first pinned comment. Now let's get back to the video. Early detection saves lives. Now that you know the symptoms and risk factors, don't ignore the signals your body may be sending. The sooner the disease is identified, the greater the chances of a simple and effective treatment. If you've been experiencing difficulty urinating, blood in your urine or semen, persistent pain in your lower back, or unexplained weight loss, don't wait. See a doctor as soon as possible. And remember, sharing this information can save lives. Send this content to your friends and family and help raise awareness about the importance of early diagnosis. Now tell me, have you had your prostate exam this year? Leave a comment. We want to hear your thoughts. Thank you for watching the video, and see you next time.